Hello, class. So our next project is to make a record base and occlusal rims. Okay, once you obtain a master cast, first thing you want to do is make sure you have all the anatomy. You want to make sure you capture the hammer notch area and, of course, your vibrating line. You want to make sure you have all your frenums and make sure there's no major voids or blebs. Okay? Once you have a good cast, your next step is to block out the undercuts. So I use a wax spatula number 7. You guys all have this in your kit. Okay? There's a round portion of it, and there's a very sharp portion at the other end. This is going to be your workhorse for waxing. Okay, so you heat the round portion of it. Okay, get a little bit of alu wax here. Okay, and make sure you scoop a little bit of wax. At first it'll feel awkward, but once you do it a couple times, you'll get used to it. Just scoop a little bit of wax. And what you want to do, first place I like to put it is around the frenums. Okay, because these frenums, you know how thin they are. The cast is a very thin area, so it's very likely it'll break. So your buccal and labial frenums, make sure you block that out with wax. I always do that no matter what, because you don't want to break the cast, because you did such a hard work trying to capture that on your board molding. Okay? So I'm just putting a light layer, so not too much, just to protect my frenum area. Okay, so I got my buccal frenum, now my labial frenum. I'm going to block it out with my alu wax. Okay, and my buccal frenum again. Okay, so here's my block out of all my frenums. Okay, so the next area I pay attention is the rugae area. This cast doesn't happen to have rugae, but a lot of patients will have a very distinct rugae. And that's another area that could break off very easily. Okay. So the rugae area is where the hard palate is. And you don't need to put a thick layer. Okay? I mean, if you make it too thick, the record base will be a little looser. So you want to just kind of minimize the wax. Just a very thin layer, just enough to block out all the up and downs and all the valleys. Okay? And also the incisive papilla. Some patients will have it very distinct, so you want to cover that. Okay. Another area that's most patients have an undercut is the retrozygomatic area, right between here. Okay, this is a this cast doesn't have it, but this area is very critical. The retrozygomatic area you want to block out, not on the depth of the vestibule, but actually towards the ridge. So you want to put it on the side. Okay, see how I'm putting it on the side? Make sure you guys can see here. Okay, so it's not. So I'm not putting it downward, but towards the ridge. Okay, so there you go. The last thing I like to look at is the anterior portion. And it's right here, okay, towards the ridge. Okay, that's another place that could have a lot of undercuts. And again, it's not towards the bottom where the vestibule is. It's towards the ridge. Okay, so you want to put it sideways. Okay, so here it is. Everything's all blocked out. And one way to check is, it's like checking your preps. You want to look at it from the occlusal view, and you want to be able to see everything without any dark or shaded area, because that indicates that there is an undercut. And to me, this looks pretty good. I don't see any undercuts. Okay. Once that's done, what you need to do is soak this in water. Okay? You need to soak this in water, and then after that, what you want to do is apply a separator. Okay? I'm using a tinfoil substitute. You guys have it in your wet lab. You guys have Alcoat, which is also a tinfoil substitute. So use that and coat maybe 2 layers on top of all the casts, including the land area everywhere. Okay? And you want to let that dry for 15 minutes before. So make sure that all the separating medium is there. Let it dry for 15 minutes. And once that's done, the next step is to fabricate the record base. Now, there's a couple ways of doing the record base. Nowadays, people use Triad a lot. That's fine. You could use Triad. But today, I wanted to show you another technique, which is using liquid and powder ortho resin. Okay? You can see an orthodontist use this a lot to make retainers. And you guys will have this for the project. And I find this more accurate. And from my limited experience, I find that using ortho resin versus Triad, it tends to stick or have more retention when I'm trying it in for my teeth try-in. So I wanted to introduce you to using an ortho resin record base here. And at first, there is a learning curve to it. However, once you get used to it, it's not that hard at all. Okay, so here's a powder. So there's the powder and liquid. And you guys will get the same as well. And the first thing you want to do is apply the powder onto the ridge on the side, like that. And then what you need to do is then use your liquid to kneel it on. Okay, so this is, some people call it the salt and pepper technique. Okay, and you can see little by little it polymerizes. And I'll just put another layer. And then put the liquid. So it's not that difficult at all. Make sure when you do this, you have your vacuum ready, because it does have a strong odor. So make sure you turn on your vacuum when you do this project. See how slowly it's polymerizing the ortho resin here? Okay. Go around. Put one more layer. Okay. So I did one side here. And before I flip to the other side, what I do is gently put the powder in here. And what that does, it holds it. Otherwise, it'll just drip all over. So I put the powder just to hold it in, and then I turn it around, and I do the other side. Same thing, put the powder in, and then I put the liquid. Okay, and then powder and liquid. And then I'll turn it around, put a little powder, and turn it around to the labial surface, put the powder on, and then put the liquid. And it's very important when you make a record base that extends into the vestibule. So it should be covering just like a denture, all the way up to the inner landmark. I see a lot of record bases that are short of it. And the consequence of that is you won't get a stable record base. So when you try it in the patient's mouth, basically you have no retention. So So make sure your record base looks exactly like the denture. So it should fill in your vestibule area, your mucobuccal fold. Okay. So once you do the periphery, now we're going to concentrate on the middle portion of it. So same technique. Let's put the powder and then the liquid. You don't really need a very thick layer. Ortho resin, it will show through, so it's okay to show through. You'll see some of the cast. Okay? Okay, then I'm putting around the ridge now. Okay, so that's it. So once you cover all your casts with ortho resin, you need to put it in warm water. And I strongly recommend using the pressure pot. You'll find a pressure pot in your wet lab. I think there's 2 or 3 of them. And you just put warm water and place your cast into your pressure pot at 20 psi, and you leave it there for a good 20 minutes or so. And once you get the cast out, you'll notice everything is very polymerized with minimum porosity, and you'll notice the difference when you try it in the patient's mouth. Okay, so this is the record base, and thank you very much.